Repetitive behaviour is an umbrella term that encompasses a broad range of behaviours, including stereotype behaviours, insistence on sameness, restricted preferences, and repetitive speech. In people with Rubinstein-Taybi syndrome, we see that certain behaviours are more prevalent than in people without Rubinstein-Taybi syndrome. For example, people with Rubinstein-Taybi syndrome tend to ask a lot of repetitive questions and may have a preference for a particular routine. We also see that people with Rubinstein-Taybi syndrome show very specific stereotypies. So, for example, hand flapping, which we see a lot of in people with Rubinstein-Taybi syndrome. Repetitive behaviour can be problematic for somebody with RTS, and sometimes it's all right, so it just depends. So something like body stereotypy, so for example hand flapping, might occur frequently but might have no real impact on that person's day-to-day quality of life. Whereas something like adherence to a strong routine could cause a significant impact, particularly if the routine changes and that causes a lot of distress to the person with Rubinstein-Taybi syndrome. And then there are other behaviours like repetitive questioning, which might not cause the person with Rubinstein-Taybi syndrome a lot of distress, but might be something that it is difficult for family members to keep momentum with in terms of being able to answer those questions, but if they're occurring multiple times a day. So in those cases, on an individual by individual basis, it might be appropriate to try to reduce some of the repetitive behaviour. If you want to reduce repetitive behaviours, the first thing to do really is to think about getting some support from a professional who has had training around behavioural interventions. So that might be somebody such as a clinical psychologist, or it could be a behavioural support team member. And the reason for that is that repetitive behaviours can occur for lots of different reasons, and we really need to have a good understanding of why those repetitive behaviours occur to be in the best position to be able to try to reduce them. Having said that, some of the strategies that might be appropriate for reducing some of the behaviours are things that families might be able to try within their day-to-day routine. But it is important, if the behaviour ever seems to be getting worse or if the person seems to be getting distressed, that that person really gets some support from an external team. If a person is really struggling with adherence to routines, and when changes to those routines occur, that's causing the person quite a lot of distress, one thing that you can do is show somebody a cue card maybe 5 minutes before that change is going to occur to let them know that a change is coming. So you'd use the same card all the time for all changes, at least when you know that they're going to happen. And the person would then learn over time that that card represents that a change is about to happen, and therefore you've made the change a bit more predictable. The really important thing to do is do that close to when the change is occurring. So we're talking about 5 minutes before, and not to do it a long time before, because the person might worry about that change and they might start to ruminate, and that might increase anxiety. So it's about kind of picking the right time for it and building up that routine around that card. Another strategy to help if someone's having difficulties with changes to routine is making sure that the person has a very clear, structured visual timetable. And that can be helpful for people across all ranges of abilities. Just being able to see when things are going to be happening during the day, and reducing uncertainty around the day-to-day events. One thing to say though about visual timetables is that sometimes people can become overly reliant on them and become very rigid, so that then when something deviates from that timetable, that causes that person more distress than if the timetable hadn't been there to start with. One way we can get around this is by starting off with quite a high degree of structure in a visual timetable, and then having a time scheduled in on that timetable, which is a question mark time. During the question mark time, there is going to be something that is occurring, which is a unpredictable activity, but the predictable aspect of it is that the person knows when that will happen. So what you're doing is you're scheduling unpredictability and helping to build flexibility into those timetables. When somebody asks a repetitive question, one way of being able to try to reduce those behaviours is to try to encourage the person to answer their own repetitive questions, or to seek out their answers to the repetitive questions somewhere else. So that might be that if the person is able to read, they've got the answers to their question written down somewhere where they can seek that out, or it might be that the answer to the question is in a visual format that they can go and look at. It is important to try to limit maybe the number of times that you respond to repetitive questions. So maybe saying, I'm going to respond to the question 4 times, but after that, I'm going to try to redirect you to these other areas where you can find out the answer, or to answer the question yourself. Or it might be that getting a time around that behaviour. So saying, there's 30 minutes where you can ask repetitive questions, and that's scheduled into a timetable. But outside of that, I'm only going to respond once if you ask me that question every hour or something like that, to try to really reduce that. I think it's important to remember that in people with Rubinstein-Taybi syndrome, the exact cause of those repetitive behaviours isn't fully understood yet. And it might be related to difficulties with memory, but it also might be a way that people seek out social contact and communicate with others. And given that it might be functioning in that way for people with Rubinstein-Taybi syndrome, it's important that as well as trying to reduce repetitive questions, the person with Rubinstein-Taybi syndrome is encouraged to develop alternative communication skills, other topics that they can discuss, and has plenty of time for interaction with family members and people that they like spending time with. We've developed a number of guides over the years about Rubinstein-Taybi syndrome through the research that we've done at the Cerebra Centre for Neurodevelopmental Disorders. And we've recently developed a guide specifically around repetitive behaviour in people with RTS, which is available by following the link at the end of this video.